Hello, I'm Dr. Sai Praveen, neurologist at Akkineni Hospitals. Hope you are doing well. In this session, we'll discuss some crucial points. Stay attentive and make your notes.
Welcome back to The Explainer. Okay, today we're diving into something that is completely and dangerously misunderstood. When summer hits, a lot of us just think of the heat as a nuisance, right? Like maybe just a reason to stay indoors or grab an extra glass of ice water. But today, we're totally throwing out the idea that heat stroke is just a severe sunburn or feeling a little faint on a hot afternoon. We are treating this exactly how emergency docs do, as an absolute life-or-death survival situation. So let's strip away the myths and get right into what's actually happening inside your body when your internal thermostat just breaks.
I want to kick things off by asking you a really direct question. Is heat stroke just severe overheating? Because honestly, that's what almost everyone thinks. Most of us just assume it's the far end of being too warm, something you can just fix by sitting under a tree for 10 minutes.
Well, the answer to that is an emphatic no. Absolutely not. Heat stroke is literally multi-organ failure in progress. It is not just your body feeling warm. It's a massive, active cellular breakdown. The clinical data on this is wild. Heat stroke actually causes direct cytotoxic damage to your cells. It kicks off this massive, full-body inflammatory response that, biologically speaking, looks basically identical to sepsis. Your body is practically fighting a full-on war against its own thermal energy. So what's the actual exact medical threshold for this? It happens when your core body temperature crosses 40 degrees Celsius. That's 104 degrees Fahrenheit, and crucially, occurs alongside critical neurological dysfunction. That second part is the real kicker. When your core crosses that 40-degree red line, your brain acutely suffers. It's that specific combination of extreme internal heat and your brain literally misfiring that elevates this to a top-tier medical emergency.
Section 1. The breakdown. When the thermostat fails.
To really get this, we've got to understand the underlying physiology, like how our internal cooling system actually collapses under pressure. Our body's defense mechanisms are brilliant, but man, they are fragile. Usually, your hypothalamus balances everything perfectly, but when you're exercising, a whopping 85% of your heat loss relies on one single thing: sweating. And this perfectly explains why high humidity is just catastrophic. If the air around you is already totally saturated with water, your sweat literally cannot evaporate. The water vapor gradient drops to zero, and your primary cooling engine, it just completely stalls out.
And here is the terrifying timeline of what happens when that environmental heat outpaces our sweating. First, if the air is hotter than your skin, the environment actively starts transferring heat into you. Then boom, your core temperature breaches that 40-degree mark. Third, things get really nasty at the cellular level. The extreme heat physically denatures your proteins and literally tears apart your cell membranes. And finally, apoptosis kicks in. That is programmed cell death. Neurons, liver cells, kidney cells, they literally start dying off.
Section 2. Spotting the danger. Classic versus exertional.
All right, let's bring this into the real world, because there is a super dangerous myth out there that we absolutely need to bust right now. There are actually two distinct types of heat stroke. Classic heat stroke develops over hours or even days, usually in the elderly, sedentary folks, or people on certain meds. Their sweating capacity is totally exhausted, so their skin feels hot and dry. But then you have exertional heat stroke. This hits athletes, construction workers, military folks, and it hits fast. Listen to this. A collapsed runner can be completely dripping with sweat and still be in the middle of a fatal heat stroke. Do not, I repeat, do not wait for someone to stop sweating before you recognize the danger.
Section 3. Spotting the diagnostic triad. So, how do paramedics and doctors actually spot this in the field? They use a three-part checklist. 1, you've got a really hot patient. 2, altered mental status, and this is huge. We're talking confusion, extreme combativeness, or ataxia, which is like this unsteady, stumbling, almost drunken gait. And 3, a recent history of heat exposure. Neurological symptoms are the ultimate defining criteria here. If they're hot, they've been in the sun, and suddenly they're acting confused or aggressive, boom, you've hit the triad.
I need you to burn this rule into your brain. Do not delay treatment just to confirm their temperature. Cool them first. Yes, technically a rectal thermometer is the most accurate way to check a core temp, but if they fit that triad we just talked about, you are in a literal race against the clock. Every single second you spend digging around for a thermometer is a second that their brain cells are actively dying.
Section 4. The race to cool.
Which brings us to the rapid response protocol. Remember, every minute spent above 40 degrees Celsius equals cumulative, irreversible organ injury. To quickly drop that core below the safe 39-degree mark, cold water immersion is the absolute gold standard. Dropping the patient in a 15 to 18-degree bath cools them by about 0.2 degrees per minute. If you don't have a tub, evaporative cooling is the go-to. Strip off their clothes, spray them with tepid water, and blast them with fans. You can also throw ice packs on the neck, armpits, and groin, but keep in mind that's an adjunct. It's meant to be used alongside the primary methods, not instead of them.
Now, there is a massive, incredibly important warning in the medical protocols here. Antipyretics, your everyday fever meds like paracetamol and ibuprofen, have absolutely no role in treating heat stroke. In fact, they're actively harmful. Why? Because fever meds work by resetting your brain's thermostat. But with heat stroke, your thermostat isn't broken. The physical environment has just completely overpowered it. So not only are these pills totally useless here, but because your liver and kidneys are already getting battered by the heat, giving someone these meds can literally push them right off the cliff into organ failure.
Section 5. The aftermath and complications.
You might think that the second the patient cools down, they're out of the woods, but surviving that initial temperature spike, that's just phase 1. We are right back to that multi-organ failure we mentioned at the start. Even after cooling, hospitals have to watch survivors like a hawk. The extreme heat causes severe muscle breakdown, which floods the kidneys with toxins, leading to acute kidney injury. Direct cellular damage triggers liver failure. The lungs can develop acute respiratory distress syndrome, or ARDS, and the massive full-body inflammation can totally wreck blood clotting, leading to a super deadly condition called DIC. The intensive care is far from over when the temperature normalizes.
So, I'll leave you with this. When the body's thermostat breaks, will you know how to beat the clock? Understanding the actual physiology of heat stroke, knowing that athletes can still be dripping sweat, recognizing those scary neurological warning signs, and knowing to cool first and ask questions later isn't just some cool medical trivia. It's a real-world survival skill, one that absolutely empowers you to protect yourself, your loved ones, and your community when the summer heat turns deadly. Thanks for joining me for this explainer. Stay cool out there and stay safe.